Hello, I'm Dr. Abhinya. I'm going to talk about hemophilia. 17th April is observed as a World Hemophilia Day. Hemophilia is a rare blood disorder that occurs when blood does not clot normally due to lack of sufficient blood clotting proteins. Every year, around 1,000 children are born with this genetic disorder. Hemophilia presents as a disease in a male child. However, female child usually can be an early hemophilia carrier. The symptoms of hemophilia are unusual bleeding after vaccinations, bleeding for unknown reason, a large or deep bruises, severe pain, swelling or stiffness in the joints, excessive bleeding after cut injuries. The cause of hemophilia depends on the type and the clotting factor. Hemophilia A is the most common type and it occurs due to insufficient clotting factor 8. Hemophilia B is the second most common type and it occurs due to insufficient clotting factor 9. Hemophilia C is a milder form of hemophilia and it occurs due to insufficient blood clotting factor 11. For those with a family history of hemophilia, there is a test to determine during pregnancy whether if the fetus is affected by hemophilia. It can be diagnosed at the average age of 9 months or almost always by the age of 2 with a blood test that shows a blood clotting factor deficiency. The newer drugs with the innovative mechanism, the older drugs with a better effective treatment, which can be given even once in a month, which can be given through a route which is more convenient into the skin and which can be widely bringing into a better benefits. All these were coming into a recent research that is a gene therapy. Other therapies include regular infusion of DDAVP, the hormone desmopressin or a clotting factor, clot preserving medications, physical therapy, first aid for minor cuts like pressure and bandage, ice pack on the skin, ice pop in case of bleeding in the mouth, vaccination against hepatitis A and B to prevent blood-borne infections such as hepatitis. Greater health concern is bleeding inside the body, especially in the knees, ankles and elbows. Internal bleeding can damage the organs and may be life-threatening. All these contact sports where there is a high impact should be avoided. There are some sports which are very good for them, things like swimming. They should also avoid intake those drugs which can affect the clotting mechanism in the body. Simple things like blood thinners and the non-steroidal anti-inflammatory drugs are not good for the patient with hemophilia. The hemophilia patient should also avoid taking any intravenous injections and should also avoid undergoing any procedures unless they are informed the doctors about the condition that they are suffering. The better they can take treatment on a replacement basis with a clotting factor rather than an emergency on demand basis. Replacement therapy with a clotting factor is a standard of care. With the adequate quality of treatment and a proper care, a person with hemophilia can live a normal, healthy life. Some of the emergency signs of person suffering from hemophilia are a sudden pain, swelling and warmth in a large joints such as knee, elbow, hip and shoulder, bleeding from an injury, especially if one has severe form of hemophilia, painful and prolonged headache, persistent vomiting, extreme fatigue, double vision, it's better to consult a doctor. Thank you.